Hi everyone, welcome to part 3 of HMIS 101, where we're going to be talking about the HMIS data standards. So on the agenda for today, we're going to be talking about what the HMIS data standards are, the various HMIS data standards manuals, universal data elements, program-specific data elements, and then we'll go ahead and proceed on to that final module and finish up. So what are the HMIS data standards? We'll get into the specifics here in a few slides, but essentially they provide communities with baseline data about the clients that we serve. Their collection requirements were developed by the Department of Housing and Urban Development, the Department of Health and Human Services, and the Department of Veteran Affairs. They allow us to collect standardized data about the individuals and families who are experiencing homelessness in our communities and across the country. So we collect these data standards in order to comply with each of our federal funding partners' reporting requirements. So there's lots of documentation about the HMIS data standards. In today's training, we're going to focus primarily on the overall HMIS data standards manual. But there are also program-specific HMIS manuals for each of the different federal funding partners. So whether you're funded by COC or ESG or HOPWA or RI or the VA, there's a program-specific HMIS manual for each of those funders. There's hundreds of pages of documentation about these data standards. So we're not here today to make you an expert about every last detail in relation to HMIS and the data standards. There's not time, and you would all tune out way before we finished covering that material. What we're here to do today is to make sure that you are equipped with a basic understanding of the different data elements that most projects collect, so you can accurately report back up the chain to each of your federal partners the tremendous and important work that each of you do with all of our clients. We know how important your work is, and we're not here to be the gatekeepers with data. We're here to help you report that information accurately back up the chain to HUD and the other federal partners, so you can continue to secure funding for your existing projects and to also demonstrate that your agency should be able to get additional funding for other projects they don't yet have. That's what we're here to do, and that's the goal for today. So a major component of the HMIS data standards are the universal data elements. These universal data elements capture basic demographic characteristics and patterns of service use, including information on shelter stays and homelessness over time. They're the basis for producing unduplicated estimates of the number of people experiencing homelessness and accessing services here in our community. And they provide the foundation for reports that are used nationally and locally to understand the current state of homelessness in our country. The universal data elements are required to be collected by all projects participating in HMIS. They're broken into universal identifier elements, which help us identify who the client is and some demographic information about them, and universal project stay elements, which are more in relation to what happened to that client while they were enrolled in our projects. We're going to run through each of these items a little bit later on in the presentation, and if you notice in the bottom left-hand corner, it'll tell you where in the data standards manual each of these items lives. So if you want to pick up that manual and flip to that relevant page, I encourage you to do so. The only element we won't talk about on this slide is 316, client location, which really only applies to clients who are enrolled in a project that spans multiple continuums of care. In addition to the universal data elements, we'll also talk about the program-specific data elements, which are required by at least one of the federal partner programs. So the items you see listed on your screen might not apply to your program, but by and large, most projects do track how much income does the client make? Do they have any non-cash benefits or health insurance? Do they have any of these specific disabilities? Or have they experienced domestic violence? We'll get into each of these items a little bit later in the presentation, but again, these are things that are required by at least one of the federal partner programs. Before we get into the specifics for what HUD expects for each universal data element and each program-specific data element, we wanted to touch on the response options for client doesn't know, client refused, and data not collected, which are responses for each of the elements. When we work with clients, sometimes they'll refuse to provide a piece of information. Maybe they refuse to provide their social security number. or maybe they don't know what their date of birth is. And that's perfectly within their rights to either refuse or not know a piece of information and still be enrolled in a program or to be provided with services. The only time where it's an issue is when that piece of information is tied to program eligibility. For example, a program funded by the Department of Veteran Affairs would need proof of active duty veteran status. So a client couldn't refuse to provide that as it's tied to program eligibility. The other important pieces to note here are client refusals and client doesn't know. Those responses are always from the client's perspective and should never be selected by the case manager or person collecting the information. Only clients can refuse and only clients can say they don't know. And if the case manager doesn't have access to a piece of information or did not collect it, they should use data not collected. It's really the staff member did not even attempt to collect the data. Regardless of which of these options you go with, it's important to note that all of them are viewed by HUD as missing data and counted against your overall data quality score. So clients can refuse to provide a piece of information, or clients may not know an answer, and that's perfectly fine. Across the country, most data elements are able to be collected by service providers. So if we notice that your agency seems to be struggling with a high number of client refusals or data not collected, we might reach out and see if there might be some training opportunities there. If there's any questions about when to use these options, or if you're worried about eligibility, please reach out to your HMIS lead agency with any of those questions, and we're happy to walk through those with you. The last thing we'll discuss before we go through each of the data elements is household structure. So a household is just an individual or a group of people who live together or would live together in one dwelling unit. And we collect information about each member of the household. One and only one member of the household needs to be designated as the head of household, to whom all other members can be associated. Now this isn't intended to mean the leader of the house. It's completely up to the clients who they'd like to list as the head of household, unless it's tied to program eligibility. So if it's a veteran service provider, you'd want that veteran client to be the head of household for eligibility purposes. Otherwise, it's however the clients want to identify as the head of household there. All right, the first universal data element is just name. So we record a client's full legal name whenever we can. It just makes it easier to find records when we're searching the HMIS system and helps us from creating duplicate records, which would throw out the numbers that we report experience homelessness in our community. So for name, social security number, and date of birth, HUD also has us indicate the data quality type that we've just entered. So for HUD, a full name reported is a full first and last name recorded into the system. If we only have a code name or a nickname for the client, we would select partial street name or code name reported. And again, there are those options for client doesn't know, client refused, and data not collected. So again, we strive for full first and last names. If you have a nickname that the client goes by and prefers over their full name, enter that into the alias field within HMIS, which is still searchable and will pull up that client record for you, but then you can still report a full name to HUD and not get into data quality issues. Anything other than a full name reported results in a data quality issue. Up next is social security number. So we should be entering a client's full 9-digit social security number whenever possible, which helps support the unique identification of each person served and helps us from creating those duplicate records, which will throw off our numbers that we report. As with name and date of birth, again, we're going to select the data quality type that we've entered. So a full SSN, that full 9-digit is a full SSN reported. If we only have a partial, maybe we just have the last 4, we would enter zeros up until the last 4 and then select approximate or partial SSN reported. And sometimes a client will refuse to provide their SSN, or maybe they don't know what it is. That happens. And when it does, it's important to select the applicable option there for the data quality type. And again, anything other than a full SSN reported here will result in data quality issues. Date of birth, pretty straightforward, right? We're just going to record the month, day, and year of birth for every person that we serve. which makes it easier to make sure we're pulling up the right record in HMIS, and also calculates the age of the people that we serve and lets us know, what's our average age of a person that's experiencing homelessness in our community. So as with name and social security number, we select that data quality type of full if we have that full date of birth there. If we have an approximate or a partial date of birth, we'd select that. And again, there are those options for client doesn't know or client refused. We're also instructed to record whatever race each client served identifies as belonging to. It's important to note that staff observations should never be used to collect information about race. This should always be from the point of view of the client. The 5 race response options in the table below align with the U.S. Census options, and you can select as many of them as apply for your client. There's also options for client doesn't know, client refused, and data not collected. And if you selected one of those things, it wouldn't make sense to select any of the category options above. Along with race, we also collect the ethnicity for each client served. So whatever ethnicity the client self-identifies as belonging to is what we record. We never make staff observations about a client's ethnicity. The 2 response options HUD tracks for ethnicity are non-Hispanic, non-Latino, and Hispanic, Latino, but there are those options for client doesn't know, client refused, and data not collected as well. We also record the self-reported gender for each client served. Another one where staff observations should never be used to collect this piece of information. However, the client self-identifies, that's what we record in HMIS. It's also important to note that gender does not have to match legal documents. It's however the client self-identifies. We record whether each client is a veteran or not, which allows for an accurate count of how many veterans experience homelessness. It's important to note that veteran status is not dependent on discharge status. So someone with a dishonorable discharge may have issues with eligibility for certain VA benefits or programs, but it doesn't mean the person's not a veteran. For most projects, we're just asking them yes or no. It's self-reported. But for VA projects, additional questions and documentation may be required. We're going to have a few slides about disabling conditions and disabilities because the way HUD quantifies disabilities is a little bit tricky. So for each client, we record an overall yes or no, does the client have a disabling condition? And what HUD means by disabling condition indicates that the client has at least one or more of the following, including a physical, mental, or emotional impairment, including an impairment caused by alcohol or drug abuse, post-traumatic stress disorder, or brain injury that will be expected to be long continuing or indefinite in duration and substantially impede their ability to live independently and could be improved by the provision of more suitable housing conditions, or a developmental disability or HIV or AIDS. So for most projects, it's not necessary for the client to provide documentation to complete this data element. A simple yes or no self-report for most projects is all that's required. There may be projects that do receive funding that have eligibility criteria surrounding disabilities where documentation may be required, but for most projects, again, this is just a yes or no. Before continuing on with the rest of the universal data elements, I do want to pull up the program-specific data elements that have to do with disabilities, as some programs are required to collect information about whether clients have any of the disability types you see listed in the table on the screen. I'd actually encourage you to pause the training video right now and just read through these to make sure you understand what HUD means by each of these disability types. If your program does collect the specific disability elements from the previous slide, you're instructed to indicate for each disability type, does the client have the disability, yes or no? If yes, is that disability expected to be of long continued and indefinite duration that will substantially impair their ability to live independently? So if you say no to that second question for each disability type, HUD actually doesn't consider that client to have that disability type. It's super tricky, and it's one of our biggest sources of errors, the conflicting responses between the overall does the client have a disabling condition, and then if you track these specific disability elements, if it's not yes and yes to overall having the disability type and it being long continued, there can be some data quality issues that arise. So it's tricky. If you have questions, we encourage you to please ask about it in the in-person training or just submit a ticket to us. We'd be happy to go over it with you, and it'll probably show up on your data quality reports if these questions aren't answered consistently. Per the 2020 HMIS data standards updates, two disability types, developmental disability and HIV/AIDS, no longer require the second dependent field to indicate whether the condition is expected to be of long continued and indefinite duration and substantially impair the client's ability to live independently. Because the presence of either of those conditions in and of themselves conforms to that designation. So for developmental disability and HIV/AIDS, you no longer need to collect the second question. It's just a simple yes or no for both of these disability types. Getting back to the rest of the universal data elements, we have project start date, which is required to indicate that the client was or is being served by your project. Without a project start date, a client cannot be included in any report defined by HUD or other federal partners. So typically this is just the month, day, and year that the client starts participating with your project or receiving services. It's important to note that different project types use project start date a little bit differently, but again, typically this is just the date the client starts being assisted by the project. We have some project types in the table on the slide and when to use project start date for each of these project types. I encourage you to pause the presentation and to quickly read through those different project types and their start dates. The last thing I'll say about project start date is that different household members within the same household can have a different project start date from one another. A head of household can enroll, and then maybe a little bit down the line, their spouse or partner or child joins the enrollment and will start receiving services. It's important to record each member's project start date on whatever day they actually receive services or are enrolled in your project. Project exit dates are required to indicate that clients are no longer being served by your project. Whether they've completed their time with your project or stopped participating, it's important to record the month, day, and year that your client has exited your project. Just like with project start date, different projects use project exit date a little bit differently. For residential projects, that can indicate the last day of continuous stay in the project before they stop residing there, or they've transferred to another residential project and they need to exit out of your project first. Or maybe they're stably housed in the unit that you secured for them and they no longer need your project's assistance. For non-residential projects, it's typically just the last day a service was provided or the last date of a period of ongoing service, or to indicate that your client is no longer participating and is being exited. The length of time between entry and exit dates is used to report on length of stay, so it's important to accurately capture when clients have exited your project. Please note that each individual client in a household will have their own exit date. If one member leaves the project before the rest of the household, their exit date should reflect that. Whatever day they actually left the project is their exit date. As a part of measuring programmatic outcomes, HUD requires us to collect destinations when exiting clients from our projects. Destinations are just where clients are expected to stay after they complete or stop participating in project activities. Destinations are grouped into three different categories: permanent destinations, temporary destinations, and other. Examples of permanent destinations include rental by client, owned by client, and long-term care facility or nursing home, among others. While temporary is more a place not meant for habitation or emergency shelter, maybe hotel or motel. And other can group those other destinations where maybe your client has unfortunately passed away or exited the project without completing an exit interview. It is important to note there is an overall other destination, but it is to be used as a last resort if none of the other destinations even loosely match where your client has headed. It's almost never other for destination, so if you're tempted to use that, please reach out to your HMIS lead agency before doing so. This slide contains the full list of destinations HUD tracks within HMIS. I encourage you to pause this slide and to become familiar with what HUD considers a temporary destination versus what they consider a permanent destination. And you can see the different project types and whether or not they're considered positive or permanent outcomes versus negative or temporary outcomes. This is an important slide because it tracks how HUD is measuring programmatic outcomes for all of our projects. Earlier in this presentation, we went over households, household structure, and how to identify the head of household. We're really just identifying one member and only one member of the household to whom all other household members can be associated, which facilitates reporting on household composition in our community and the overall number of households served. So it's pretty straightforward. The relationship to head of household, for the head of household, they're just the self. That's their relationship. If there are any children in the household that belong to the head of household, they're the head of household's child. Similarly, the head of household's spouse or partner, that would be their relationship. And the head of household's other relation member, maybe if there's uncles or aunts or cousins in the household, we would select that option. Lastly, we could select other non-relation member for any household members who aren't related to the head of household. Households are just groups of people who self-define what their household structure looks like. They do not have to be related to be in the same household and enrolled as a household in your project. We also record the housing move-in date, and this is simply whenever clients enrolled in a permanent housing project of any kind, which includes rapid rehousing, whenever we move them into a permanent housing unit, we need to record their housing move-in date. It's important to note that project start date typically is not going to be the same as housing move-in date for our clients. This has been a point of confusion in our community, and it's something we wanted to discuss here today in training. It's possible that in some instances a project start date might be the same as the housing move-in date for a client, but for the vast majority of our clients who are entering our permanent housing projects, they're not moving in to a unit the same day they're enrolled into the project. So this element allows us to measure how long it took from program entry to housing the client and then to exiting the client out of the project. It's also important for the point in time count and the housing inventory count, as clients who have housing move-in dates are not counted as literally homeless in our community, and clients who are housed and have this move-in date are listed as in housing. The only other two caveats we'll cover today are for rapid rehousing projects, who are instructed to record housing move-in dates regardless of whether or not the rapid rehousing project actually is the one providing rental assistance to the client. For all other permanent housing projects, clients who receive pre-housing services by that project but who are ultimately housed by another project or subsidy source need to be exited from the permanent housing project using the appropriate permanent destination. So this can be tricky. If there are questions about housing move-in date and how to use this element, please reach out to your lead agency and we'll go over those things with you. For all adults and heads of households that we serve, we're instructed to record the prior living situation and how long they were in that prior living situation just prior to project start. It's important to note that adult members of the same household may have different residences prior to project entry. Sometimes folks are coming from different places as they enroll into our projects, and we can accurately capture whatever each of those prior residences are and how long each of those clients were in those locations just prior to project start. The types of questions we ask clients about their prior living situation can sometimes vary depending on the project type the clients are entering. So for street outreach, emergency shelter, and safe haven projects, clients are generally entering from living situations of literal homelessness. So we just start by asking, what was your living situation immediately prior to entering the project? How long ago did you start staying in that place? What's the approximate date or your best guess for when your homelessness, your most recent bout of homelessness, started? And then how many times have you been literally homeless in the past 3 years? And how many total months have you been homeless in the past 3 years? For all other project types, the questions we ask clients about their prior living situation is going to be dependent on what that prior living situation was. So we first just start with, where were you right before the project start? Where were you staying? If they were staying in a literally homeless situation, then the questions we're going to ask are the exact same as the questions we reviewed on the previous slide. So that's pretty straightforward. But what if they're coming from an institutional or a permanent and transitional housing situation? And by institutional, I mean maybe a psychiatric facility or a hospital or even a jail. So how long was the client staying in either of these scenarios there? Was the stay in the institution for less than 90 days? Or was the stay in permanent or transitional housing less than 7 days? Now these numbers are important because HUD views a stay in an institution of more than 90 days as a break in homelessness, the same way they view a stay in permanent or transitional housing that's more than 7 days as a break in homelessness. So if no, meaning the client did not stay less than 90 days, so they stayed more, or they did not stay less than 7 days in permanent or transitional housing, they stayed more, we stop asking questions because that's the workflow that HUD and the federal partners require us to collect information about. But if the answer is yes, so they did stay less than 90 or 7 days in either of these situations, we move on and we ask, on the night before you were in that institution or permanent housing location, were you on the streets, in shelter, or in a safe haven? If not, again, we stop asking questions. We've fulfilled the requirement that we need to enter into HMIS. But if it's yes, then HUD views these clients as entering from a literal homeless situation, and we proceed through the rest of the questions. So we know this can be tricky, the way that HUD and the federal partners are asking us to collect this information, and just to have the ability for the client to recall all of this trauma. It can be tricky, and whatever the client self-reports, unless your specific project requires documentation of prior living situation and literal homeless status, whatever the client goes with is generally okay to input into the system. If you have questions about how to collect this information, please reach out to your lead agency, and we'll work with you to make sure you understand what HUD and the federal partners are after and how to collect that information from your clients. All right, we made it through all the universal data elements. We only have a few program-specific data elements left to go through, and then we'll proceed on to that last training video. So this program-specific data element is tracking income and sources of that income for all adults and heads of households that we serve. We should follow the guidelines provided by project funders. Some funders do require income verification documentation, and data recorded in HMIS does not replace that requirement. Generally, we're just recording the amount and the source of each amount on a monthly basis for each income source for our clients. These pieces of information are collected at project start, at annual assessment, and project exit, as increase in income is a key performance measure of most of the federal partner programs. They want to see that as clients work through our different projects, they're getting access to an increase in income. Similarly, we're also recording for heads of households and adult household members whether or not they receive any of the listed non-cash benefits. Do they have SNAP, things of that nature. Quick general rule here: benefits received by or on behalf of a minor household member or on behalf of the entire household can be included in the head of households record. Again, just like with income, we're collecting these at project start, annual assessment, and project exit, and increase in benefits is another key performance measure for the federal partner programs. And we also collect information about each client, including children, in terms of whether or not they receive health insurance from any of the listed health insurance sources in HMIS. So we record this for all household members, so adults and children. But just like income and non-cash benefits, we're primarily collecting those at project start, annual assessment, and project exit. So this program-specific data element is asking whether heads of household and adult members of the household are survivors of domestic violence. So yes or no. It's important to note that verification is not necessary unless it is specifically required for project eligibility. This is sensitive information, and we want to be cognizant of that fact. But the intent of this question is to ascertain whether a person is a survivor of or fleeing from domestic violence, as it's necessary to know that to provide them with the appropriate services to prevent further abuse and to treat the physical and psychological injuries from prior abuse. It can also be important for the client's safety and important for the safety of project staff and other clients to know this. So if the client does indicate that they're a survivor of domestic violence, meaning they select yes there, these questions A and B, when experience occurred and are you currently fleeing, will appear. So select the appropriate response types there for when did it occur and are you currently fleeing. There are also options for client refused, client doesn't know, and data not collected. Current living situation is a restructured data element for 2020, and it's replacing the previous contact element, which was required for street outreach projects and night-by-night shelters. So moving forward, this current living situation element is required for COC-funded street outreach projects and coordinated entry, ESG-funded street outreach and night-by-night shelters, RHY-funded street outreach, and all PATH projects, so both services only and street outreach for PATH. So the data collection instructions for current living situation are to record the date and current living situation the client reports each time a contact with the client is made. Contacts that require the collection of current living situation include activities such as a conversation between a street outreach worker and a client about the client's well-being or needs, an office visit to discuss their housing plan, or a referral to another community service. Those are some examples. So depending on the current living situation reported by the client and the funding type that you have, additional questions may be required. And your HMIS lead agencies are going to be working to disseminate additional resources for agencies and projects that are required to complete this new current living situation assessment, and those will be posted on our help desk as well, which is cohmis.zendesk.com. Date of engagement is a field that's required for street outreach, night-by-night shelters, and all PATH projects. And it's where you record the date a client has become engaged in the development of a plan to address their situation. Engagement is defined as an interactive client relationship, which results in a deliberate client assessment or beginning of a case plan. It's important to note that reporting on data quality for street outreach projects is limited to clients with a date of engagement. If you have any questions about date of engagement or when to enter that, please contact your HMIS lead agency or refer to guidance in the program-specific HMIS manuals for PATH, COC, ESG, and RHY. The last few program-specific data elements we'll talk about are bed night date, coordinated entry assessment, and coordinated entry event. So bed nights are required for night-by-night shelter projects, and that indicates the date a client utilized a bed. This is typically tracked as a service for clients in night-by-night shelter projects. So every night that a client stays at a night-by-night shelter, there should be a service assigned to them for a bed night indicating they were there that night. It's also important to note that there must be a record of a bed night on the project start date into a night-by-night shelter. Other than that, there are a couple of coordinated entry data elements that we won't spend a lot of time talking about in this training. Just know that if you participate in coordinated entry, there might be some different requirements per COC. Some of these elements are flexible, basically assessments that are used to track information about clients and help prioritize them for housing. So the coordinated entry teams in your COCs will speak more to these elements if you're going to be participating in coordinated entry. All right, you've made it through the longest of the training videos, and we've certainly covered a lot of material here. If there are any questions about anything discussed during this training or anything to do with the data standards in general, please reach out to your lead agency via the shared statewide help desk, which is just cohmis.zendesk.com. Otherwise, proceed on to part 4, and then we'll wrap up with HMIS 101 training.